Welcome to this special edition of Neurology News Network. I'm Marco Meglio. Please excuse our appearance this week as a majority of the U.S. workforce, including the Neurology Live team, moves to working remote as we come together to help reduce the spread of the novel coronavirus. First up, findings from a recent study by the National Infantile Spasms Consortium suggest that adrenocorticotropic hormone, or ACTH, and oral steroids are superior methods for treating infantile spasms when compared with non-standard therapy. The prospective multi-center observational cohort study included 423 children with infantile spasm that began at 2 to 24 months. Using chart review, investigators found freedom from treatment failure rates were 46% for ACTH, 44% for oral steroids, 37% for vigabatrin, and 8% for non-standard therapy. Investigators accounted for estimated superiority of standard therapies, and higher E-values suggested findings would not be contraindicated with unmeasured confounding. Vigabatrin, a GABA transaminase inhibitor, was estimated to be more effective than non-standard therapies, but less effective than ACTH and oral steroids. Despite being underpowered for statistical significance, it was found to work for children with tuberous sclerosis complex, with freedom from treatment failure rates for those with TSC highest at 62% when compared with other treatments at 29%. Next up, findings from a recent observational study confirmed a significant difference between patients with obstructive sleep apnea and those without, as well as a correlation between biomarker levels and OSA severity, indicating that secondary electrospray ionized high-resolution mass spectrometry, or SESI HRMES, may be a viable screening method. A panel of 33 metabolites/breath biomarkers were validated in the observational study, confirming previous findings of the OSA-specific metabolic breath pattern in a pilot study. Future validation studies are necessary to investigate the value of SESI HRMS in coordination with OSA screening questionnaires, and additionally, studies should include larger cohorts. Lead author Nora Norak and colleagues wrote, "To the best of our knowledge, this is the first report of a validation of breath biomarkers for OSA. Previous studies using eNotes, offline gas chromatography, coupled to mass spectrometry, or enzyme immunoassays to analyze exhaled breath condensate have achieved promising results regarding the distinction between OSA patients and controls without OSA from exhaled breath. However, sample sizes in all those studies were limited, and none of the results have been validated in an independent cohort of patients." Lastly, recently published findings suggest that CSF myeloid microvesicles have diagnostic and prognostic value in predicting neuroinflammation and microglial/macrophage activity in vivo. The results also support possible use in clinical practice to complement MRI and clinical evaluation at the moment of multiple sclerosis diagnosis. Investigators evaluated CSF myeloid microvesicles in 601 individuals with diagnosis of neuroinflammatory, neurodegenerative, or no neurological disease at discharge or follow-up. Myeloid microvesicles were measured with flow cytometry as inselectin B4 positive events in fresh CSF. A post-hoc analysis showed statistically significant differences in median myeloid microvessels concentration between the neuroinflammatory group and the neurodegenerative/dementia group, and between the neuroinflammatory group and the control group. Notably, no differences were found between the neurodegenerative dementia group and the control group. For more direct access to expert insight, head to neurologylive.com. This has been Neurology News Network. Thanks for watching.